Okay, so I just want to introduce Dr. Paul Strutt, who's a postdoctoral fellow, Department of Cognitive Science. He's going to talk to us about his survey during COVID. Oh, I need to wipe it. I forgot my wiping, sorry. Look at the video online.
Okay. Walk around. Okay, so hello everybody. Nice to see everyone this afternoon. So, as we said, Paul Strutt, cognitive science, member of Centre for Ageing, Cognition and Wellbeing, and just here today just to talk about a study that many of us within the centre collaborated on. And so with the idea of really trying to capture the impacts of COVID-19 lockdown restrictions on the daily lives of older adults in Australia. So it was really a collaborative effort, and very much, I think you'll see that in the data that was collected. It's quite a diverse data set because we had the contributions of lots of different expertise and research backgrounds. So I don't think I need to go over this in a great amount of detail in terms of the Australian context for COVID-19 lockdown. Just as a quick refresher. So, you know, the first case in Australia diagnosed in January of 2020. And so the first wave of lockdown restrictions is really what we're discussing in reference to today. So it took place between March and late May of this year. And so, like everyone, but especially for older adults, there was strong encouragement for older adults to stay at home. And very much limit, you know, contact with the outside world, essentially. And so, you know, by using strategies like getting home deliveries for groceries and minimising contact with people outside of the home. And when you think about that for older adults, obviously there's older adults that are at a higher risk or more vulnerable for social isolation and loneliness even before COVID hit. And so there's kind of these sort of compounding impacts of those lockdown restrictions that need to be considered. And so the other question is, okay, so we know that there's been these impacts. We can have a bit of an idea about what kind of aspects of the older adults' lives we think might be impacted by lockdown. But really there hasn't been a lot of work that's sort of specifically tried to investigate those impacts for older adults. So what we do know is that older adults are at greater risk of psychological and physical illness and mortality from COVID-19 relative to younger adults, and that they do report increased like peritraumatic distress and social functioning impairments compared to younger adults. More broadly, in terms of some of the research that has been done, so we know that there's been impacts on health service usage broadly. So, for example, you know, lower numbers of hospital admissions, and as well. So, you know, we need to think about, I guess, not only the physical and the psychological impacts that you know, older adults might experience, but also given there's the impacts to how they may be able to access their communities. One of the questions is, you know, thinking about access to health services and health service usage and decision making around that. Video call technology has often been sort of discussed as a way to kind of mitigate the effects of lockdown in terms of, so I guess academics be very aware of, you know, the use of Zoom to kind of, you know, keep connected in a work setting. But also to keep connected socially. And the question is whether, how well and by how many the video call type technology might be, or technology in general might have been adopted by older adults. But again, like I say, few studies have really investigated these things. So our group is really interested in trying to capture a snapshot of all of those kind of domains. So in terms of physical health, health service usage, emotional health and quality of life outcomes. We're also interested in looking at family relationships. So in particular, for this study, we looked at the impacts of lockdown on grandparenting, the grandparent-grandchild relationship. and also uptake of new technologies. And then thinking about as well about how all of these factors could either be sort of risk factors or protective factors for better emotional health and quality of life outcomes. So considering all of those things in combination. So in terms of what we did, we were able to, put together an online survey using many standardised questionnaires. For those that are interested, they are listed there, but we're essentially interested in tapping into those depression and anxiety, quality of life outcomes, loneliness, social isolation, and emotion regulation strategies as well, given that might kind of mediate the reactions to lockdown. We also had some kind of in-house questionnaires that were built by members of our team. So the grandparenting questionnaire, as I mentioned. We also asked questions about changes in dietary habits as well, physical activity, and technology use, which I've touched on briefly. So I'm going to try my best to cover all of those domains or to summarise some of the interesting results from those domains for you here. So what I wanted to discuss firstly was just, I guess, the physical health aspects. So just in terms of characterising the sample for their current health conditions, we had, I should have mentioned, sorry, so there was 201 community dwelling older adults that were recruited for the study just through existing research databases here at Macquarie. It was just a cross-sectional survey, and the data were collected at the end of May, so the third month of the lockdown restrictions that were put in place. So with that context, so within that sample overall, so 46% of our respondents reported that they had a long-term health condition of some kind. The most common of those conditions were bone and joint conditions, with over 72% of older adults reporting the presence of those. Hearing and vision impairments of some description were reported by around 48% of the sample. So potentially underreported, but still quite high relative to other difficulties. And then interestingly as well, just in the context of COVID, looking at respiratory conditions in general, so asthma and bronchitis, COPD, there's a reasonably high prevalence of those conditions as well, which just, I think, speaks to the vulnerability, the increased vulnerabilities of our sample in the context of COVID. In terms of health service use, so we know that there's quite a large number of people in our sample that had pre-existing long-term conditions. And the question is, okay, well, how did that impact their use of healthcare services? It's one of the many questions. And what we saw just in terms of accessing services generally was that 75% of our respondents visited a doctor or nurse at some point during lockdown. But when we looked at, so just the subgroup of people with long-term health conditions, there was around 10% who indicated that they were unable to access medical assistance for some reason during lockdown. And then also there was 15% of those with long-standing conditions that indicated that they delayed treatments, so made the choice to delay normal treatment for a pre-existing condition. And that varied from regular health checks to specialist consultations and GP appointments, routine blood tests for monitoring of conditions, as well as prescription renewals. So there was some qualitative comments in there as well from a few individuals that said, they had chosen not to renew prescriptions and that had run out of medications and that had caused, secondary complications as well. And so the open question there, I suppose, is obviously there's the immediate risk to the individuals when making decisions of that nature. And what are the kind of long-term impacts of people delaying their sort of routine medical follow-up is an open but important question here. And I should say, so I removed a slide, but there was an interesting, so 50% of people who chose to delay was because of the fear of COVID, but there was also another, I think 30% or so that said they were unable to access, say, their normal medical services because they were closed as well during COVID. So moving on to our next domain. So if we're looking at physical activity, we're able to look, what we asked people to do here was they filled out the IPAC, standardised questionnaire of physical activity. They did it. We asked about their current physical activity, left or, okay, and asked them to do some retrospective reports of physical activity as well. And what we saw was that there was an increase during lockdown of people engaging in domestic and garden activity, but there was a decrease in vigorous physical activity for leisure, so exercise, essentially. We also saw that there was less walking, significantly less walking during lockdown, and more time spent sitting during the day overall. And then in terms of intensity of exercise, there was an increase in moderate activity, so associated with increases in domestic and garden activities, but a reduction in vigorous activity. So some notable changes there. There were also changes in diet choices, so increased consumption of discretionary foods and dairy products, but alcohol consumption remained mostly stable for most of the sample. Emotional health and wellbeing was an interesting area that we looked at as well in terms of kind of what appeared to be the elevated depression symptoms and anxiety symptoms as well. Around 20% of the sample reporting elevated levels of psychological distress. And this is in comparison, all those is cross-sectional when we compare it to previous reports from Australian Institute of Health and Welfare data from 2015. The prevalence appears, at least in this group, to be higher than those previous estimates. In terms of grandparenting, so I think the general message is that there was that particular relationship is resilient and adaptable. So there were problems identified with or challenges identified with being a grandparent, but the perception of the quality of the relationship, for the most part, was not impacted by, so reduced weekly contact, for example. And the adaptability comes in where grandparents, a higher proportion, so only 26% of older adult grandparents previously were using technology, and that increased to 47%. And then technology use more generally, so across the entire cohort, there was quite a high uptake of new technology, which I think was a really encouraging sign. So 63% of older adults reported using new technologies for the first time during lockdown. And that was mostly for social purposes, and most of that was, so 82% was use of video conferencing technologies to keep in touch socially. So really highlighting the adaptability of the older adults. 2 minutes, okay. So just briefly, when we started to look at all of these factors and how they were associated with emotional health and quality of life outcomes, in terms of the raw bivariate associations, living situation, degree of social integration, technology use and grandparenting were associated with various psychological and quality of life domains. When we I'm not going to go through that in great detail, but I just wanted to highlight that when we combined all of those outcomes into sort of our more comprehensive modelling, the predictors that were coming out as quite strongly linked to psychological health and quality of life outcomes in particular were loneliness and rumination, which I think is kind of consistent with some of the other talks that we've had discussions about today. So what does that actually mean? I tried to sort of summarise that in 3 points because I knew I'd be running low on time by the end. But I think in terms of emotional health, there's sort of, if you're thinking about intervention and how we can help older adults in the context of ongoing lockdowns that may occur in future, interventions that focus on social isolation and loneliness, as well as the processes like rumination that might maintain those the elevated psychological distress, might result in better mental health outcomes. And in terms of health and lifestyle, interventions to assist older people to maintain healthy lifestyles could focus on kind of promoting vigorous activity, so exercise, and being more mindful about how to implement that during lockdown, particularly because we know not everybody has access to something like a private garden where they could use that as a compensatory type activity. And then diversifying technology use as well. So there was a high uptake of new technology in our sample, which was associated with better psychological health and quality of life. So if we could further enhance technology use and then sort of, add to its wider applications as well. So in terms of thinking about access to health services and, physical activity, they're kind of two domains that could be quite useful. So I'll leave it there. But yeah, thank you for the input of the team, and I appreciate you listening to the talk. Thank you. Okay. Any questions?